Okay, good afternoon and welcome to today's webinar, Public Healthcare Sector Advancing Environmental Sustainability, highlights from Danville State Hospital and the Altoona VA Medical Center. I'm Mark Hangren, Gov Council Director, and I'm very excited about these presentations today. Danville State Hospital is with us, and they are the oldest state psychiatric facility currently in operation, which was incorporated way back on April 13th, 1869, and officially opened in 1872. And I bet that Danville State Hospital has quite a very interesting story to tell on its own. And then you overlay the good work being done with environmental sustainability, and there's so much more to tell. And we also have environmental sustainability successes that are taking place at the Altoona VA Medical Center. The medical center was renamed James Van Zant VA Medical Center after 11-term U.S. House of Representatives and former veteran of the U.S. Navy who served in both World War I and World War II. The medical center and Altoona Healthcare system offer services to 87,000 veterans in the local area. And before we jump into introducing the presenters, I just wanted to do a little bit about GreenGov for those that may not be familiar with us. The GreenGov Council was established through executive order and requires Commonwealth agencies to lead by example on environmental sustainability. So you can learn more about our program on the GreenGov website at dgs.pa.gov/GreenGov to see how our agencies are performing against our goals, our environmental sustainability goals. We also have lots of recordings from past webinars from our sustainability series and Sustainability Week, which just ended last week. So we have lots of great content from lots of speakers from over just the recent weeks and also the recent years. So you can also sign up for future webinars on biogas development in Denmark, community health challenges and climate change, K-12 sustainability standards, funding opportunities for energy projects, sustainability-related careers in the Commonwealth, and a featured program to help at-risk teens graduate from high school and succeed in selected careers. We also have, there's lots of other things going on our website and what we're doing, but you can also sign up on our website for the Pennsylvania Climate Network. And the Climate Network currently has a free 8-hour climate training available. The training is broken up into 4 modules, and those that complete the training will receive a certificate of completion. And we encourage you all to join our mailing list and get involved with this growing this network of climate leaders in Pennsylvania. And so I also want to introduce today's webinar is co-hosted and supported through our partnership with Penn State Sustainability. And I want to introduce Peter Boger. Peter Boger is Assistant Director for Community Engagement at Penn State Sustainability and is responsible for developing strategic programming and partnerships that help Penn State leverage its resources to promote sustainability through Penn State campuses. Welcome, Peter.
Thank you so much, Mark, and thank you everybody for joining us today on this really fine fall afternoon. As Mark mentioned, my name is Peter Boger. I'm the Director for Engagement at Penn State Sustainability. And much like the GreenGov Council is a small but mighty team serving a very large set of diverse organizations across the Commonwealth government, Penn State Sustainability is a small but hopefully mighty team serving the entire Penn State system, all 24 campuses across the entire Commonwealth. And it is our mission to try to instill sustainability into all aspects of what Penn State does, its teaching, its research, its student engagement, its operations, and most especially our engagement with the Commonwealth. Penn State really takes seriously our mission as the land-grant university for the state of Pennsylvania, and that mission being of service to help all of the communities across the state achieve their goals. And specifically with sustainability, how do we help build more sustainable and resilient communities across the Commonwealth? And part of that mission is education opportunities like this partnership that we really have enjoyed with the GreenGov Council now through the start of this 6th series of webinars, which we find are a fantastic opportunity to bring together people diverse backgrounds, both as our speakers and you and our audience, because we know we have people here from state government, from municipal governments, from universities, students, nonprofits, and trying to really create a community across the Commonwealth that cares about sustainability issues and connecting them with people like the experts you'll hear today to inspire you, to help you go back and think about, no matter what it is you do, how can you incorporate sustainability into your work? How can you maybe implement or um, uh, stimulate some of the things that you'll hear about from our speakers. So we are delighted that you joined us today. We are so grateful for our partnership with Matt and Mark. And with that, I'll hand it back to you all.
Okay, thanks, Peter. So yeah, I'd like to jump right into it now and introduce TJ Burke from Danville State Hospital and Glenn Holsinger with Altoona VA Medical Center. So TJ Burke has been in human services field for over 35 years. TJ started in county government human services and then went to work with the Department of Human Services in 1995 for the Bureau of Financial Operations. In 1997, TJ started working at the Bureau of Hospital Operations in the Office of Mental Health and Substance Abuse Service within the Department of Public Welfare. TJ came to Danville State Hospital as Chief Operations Officer in 2004 and was in that role for 18 years. And in 2022 became the Chief Executive Officer. And TJ is very passionate about reducing greenhouse gas emissions and waste within the hospital. And then next up, we'll hear from Glenn Holsinger. Glenn grew up in Roaring Springs, Pennsylvania, and graduated from Hollidaysburg High School in 1975, where he then joined the U.S. Army as an armored crewman and served the country for 30 years, retiring as Sergeant Major E9. Glenn retired from the Army and returned home, but continued to have the urge to serve his country, which led him to the Veterans Administration. And Glenn currently works as the Green Environmental Management System, or GEMS, program manager. He is responsible for implementation and current sustainability operations for the James Van Zandt VA Medical Center in Altoona, PA. And Glenn's facilities have received numerous awards for performance and sustainability from his local county, Practice Green Health, the Environmental Protection Agency, and the Veterans Health Administration. Glenn is proud of those accomplishments, but more importantly, the quality of care provided to his fellow veterans in Altoona. So I'm looking forward to your presentations, and thanks for joining us today. TJ, I'll turn this over to you.
Thank you, Mark. Thank you for the introduction, and welcome everyone to today's presentation. I'm just trying to get on the slideshow that I have to guide us. I apologize. Just did it a little bit ago, and now I'm having problems.
Yep, and the share button should be right next to the exit. Yep.
Yeah. Let me just give everyone, while this is populating, a little bit of information about Danville State Hospital. We are, as Mark said, we are the oldest operating state hospital in the state of Pennsylvania. Our cornerstone was established in 1869. First patients were in 1872. We are a bed of 161 patients currently. We operate 6 units. And our location is rural Pennsylvania, center part of the state along the Susquehanna River. We have a huge medical center by us, Geisinger Medical Center, that we do partner with. But because of our setting where we're at, we're blessed that we have a lot of natural environment around us. It's kind of part of our history and a part of our lifestyle in this part of the state of enjoying the environment. And with that, we want to protect it. So you will see the first slide that you see is just a little heading of ours, and it shows some of our steps we have taken in repopulating the grounds with wildflowers for our pollinators and such. But I just want to go real close that our agenda here is the mission, little statement for myself, and a program we give to the staff every year of what we've been doing and so forth. Then basically our mission, boiling it down, is that we want to do less harm to the environment as possible. You know, if you look at data, hospitals produce a lot of waste. Different hospitals more so than others, but even a hospital like ours, we do produce a lot of waste. So for many years, we've been trying to reduce that. And I want to point out where we've gotten to today started 20 years ago. It's not something that we did overnight. It was little steps over the course of time. Fortunately, I have very good staff here that feel the same way, that we need to do less harm than not to the environment. And it also provides good patient care when we do that for our setting. There's many studies out there that show that the environment has drastic impact on someone's mental health. And just like it does for physical health, but it has an impact on mental health. We have areas now that we can provide better therapeutic programs for our patients because of this. So when you start going green, it can serve many other purposes. We've also been able to save a lot of money by going green. So I'm not going to belabor and go through all of these slides, and I don't like when people read slides, so I'm not going to read them, but they're here for your information, and hopefully you can print them off at some point. I'm not sure how that works, Mark, if you can help with that. So I want to point out some of the accomplishments that you'll see on this slide. On this slide, you will see that we've decreased since 2010 our electricity use by 21%. With that, we've been able to save $4.6 million, which fortunately we are able to put into patient programming then. Because again, we try to tie everything back into what we do well for the patients. We've also, since 2020, we have reduced our water usage by a tremendous amount. Also our landfill, we have saved over since 2010 $56,000 and reduced it by 1.1 million pounds of trash into the landfills. So let me just give you a little history. We started our whole green process with actually energy savings is where we started it from. We've operated a coal burning furnace plant since the beginning of Danville State Hospital. As we all know, that's a heavy carbon producer, even when it is ran efficiently. So over time, we've reduced our dependency on coal, and we've gone to natural gas. Even though it is still a carbon producer, it's reduced the amount of carbon. It's not as dirty. We will, by next year, completely be out of using coal at all. Right now, we only use it about 2 weeks out of the year, and that's really just for the really cold time and to do our smoke testing, and that's it. Because we've been able to, through the staff here, run our own gas line and hook it up to the main gas line and be able to use the gas. Even when we started this process, we had a steam turbine that we were able to have the steam pass through and make our own electricity. Now, fortunately, that we have reduced the dependency of fuel and had to turn down that we don't have any waste in our steam and such, we don't have as much return, so we don't use that anymore. But that's a positive thing. That means we did better on the front end of things. So we were able to go through the hospital and reduce our dependency on lighting. We've changed to daylight harvesting in some of our rooms, where we actually have the lights dim and get brighter based on how bright it is outside because of the windows we have. Being able to let natural light in. We've done some of those things. We've also have done a tremendous amount of work on water, which I will go to next slide. We just have here some of our environmental strategies for hospitals. Historically, healthcare has always treated disease. And with what we try to do now is use the environment to help people help themselves through their disease process for mental health. You'll hear me talk about then about what we've recently done in the last 2 years. We have a campus of about 100 acres, Andrew, 150 acres, and that's including our building structures and everything. And we've taken 16 acres and we've repopulated it with native trees and bushes and wildflowers. And this has been in cooperation with DCNR and with the local Montour Conservation Center. And it's been a big push for us to help capture the carbon in the air. Now, we have not done the calculations to see how much offsets, but we have looked at the more property we do have the trees on, the more carbon we will be able to capture. And that is a big, I think Mark mentioned that before, that we are really looking at that. And we really look at our utilities as one of our biggest pieces that we can help control and reduce our waste. As you will see in the slide ahead of you, in front of you, it is about water management. With a property this old, our pipes and everything are quite old. And so we have gone through and we continue to update them and so forth to reduce our water consumption. And we have reduced it by a tremendous amount, as you will see in the slide. And I've already talked about the carbon. And in front of you, you will see what our energy conservation has done. We have reduced our electricity tremendously over the years, and we continue to do that. And the interesting thing is we've been able to do this at the same time of expanding program space and units, because we are expanding into a new unit that will have additional beds in the near future. But we've been able to do this all even at the same time we've been able to reduce our use of electricity. Sorry, my eyes aren't good to look at the screen and everything, so I do have to flip over my paper charts. We put into part of our presentation here, we put in our recycling and waste management, just to give you some data. I'm not going to go through this in detail, so that's why I hope you can print this off, because it does show what we've been able to recycle, which we continue to expand. One of the things that we've done probably about 5 years ago is we created like our own Green Council. We have a committee of folks who are dedicated to coming up with different solutions to some of our problems of waste. Waste is a huge factor in hospitals. And we do want to look at how we do waste for anything from our construction waste, from when we do remodel, to our food waste that goes out every day in the trash. We have a program now for that to reduce the waste in the sense of taking out the liquid so that we can use it in our composters. We have a small garden program that we use some of that for. We also are in the process of purchasing a large industrial composter to put all the food waste in, so that way we can use it more for our garden program that the patients run. We have also really are looking, and this is a little tricky one with state government and the contracts and seeing what's on the statewide contracts, but we are reducing our dependency on traditional cleaning products and going to more environmentally safe ones. We waste so much or do so much harm to the environment with some of those chemicals, but the tricky part for hospitals is to make sure that we still disinfect. As we all know with COVID right on our back door and everything, that we really have to look at those products. So it's really balancing the need for an environmentally safe area for our patients, but at the same time, looking how we can reduce the negative effects of the cleaning products. So you will see on this slide some of our things that we've done to strategically clean. One of the one of the big things that I want to point out, and I think this is something that we all want to get to the end road real quick. I'm sometimes an impatient person, and I want to do that. But the thing is, taking the little steps over time has really helped. We have all of our staff now in the whole hospital. Really, they come up with the ideas, and they bring so many different ideas to us at this point. So it's a cultural change. We have less waste here because of the staff. It's really embedding into the staff what we need to do for the future and how they're the ones who are going to make it successful or not. And we continue to do that day in and day out. Everything gets fielded through our committee, and then they will come up with recommendations to myself and to my executive team for us to figure out how we can make it happen. One of the next major projects we're doing here on campus is stormwater. We have 2 ravines that all the roof stormwater goes into, which goes into the Susquehanna River. We have been able to reduce the amount that goes in by creating French drains, per se, where we've created the culverts, diverted them back into the ground, and that they will now be filtered through the trees and everything before it gets to the ravines. So we will be adding less pollution into the Susquehanna River, which is a great asset to our natural area around here. I guess to leave you, because I know I'm going to be running out of time here, to leave you with some things is the fact that, it's really just making a commitment to doing what you can to lessen the impact and taking little steps over time, which will grow and grow. Because sometimes it can be frustrating to think you're not moving forward, but you are. To get where we have got to, and it's taken 20 years. And we still have a lot of room to grow. But, I think two of the biggest things I think we are doing is our reforesting of the grounds, because trees are such a natural filter that it's very important. But that also creates great program areas for our patients to go out to do therapies in. And also our water diversion into the river are 2 of the biggest things I'm very proud of, because I think it has the biggest wins that we have, along with the reduction of the use of coal that go into the natural gas has, even though it is still fossil fuel, we've reduced our emissions tremendously. I would love to get out of it, but out of a boiler plant, but it's hard to do. Solar won't run a place like we have here completely and such. So, Mark, I'll wrap it up there because I know we're on a time constraint, and I'll pass it on.
Yep. Thanks, TJ. And yeah, every bit counts. And yeah, I feel like environmental sustainability is a bit of a marathon. I'm with you on that. It's a long process, and we all have to sort of play our part and get there. So I'm going to pass it to, thanks for your presentation. And we're looking forward to talking to you after this is over. I'm going to pass this to Glenn to kick off the medical center, Altoona. Welcome, Glenn.
Yep. Thank you for inviting me. I'm Glenn Holsinger from the James E. Van Zandt VA Medical Center out here in God's country in the center of beautiful Pennsylvania. Can you see my screen right now?
Yes, Ken. Yep.
Okay. I'm going to talk more about like the operational aspects of like what I did for my sustainability officer. First of all, I want to congratulate TJ. That was an outstanding presentation, and you guys are doing wonderful things. Our sustainability journey here in Altoona pretty much was the same thing. We started around 2006 with our program, and we started getting major success around 2011. But when you do any of these things in a hospital or a facility, especially a hospital, it's kind of like eating an elephant. You can only do it one bite at a time. You're not going to be able to do it all at once. So it's one bite at a time, and it's steady improvement or constant improvement over and over. And a big hurdle in it is getting the cultural change of your staff and all your sections and teams out there. One of the changes that the VA recently has done is make your facility sustainability officer somebody in your executive council or in your executive board, which gives you a little more push to mobilize people to do what you want them to do, or to start thinking in the nature of being more sustainable. So this presentation is about when we got a new sustainability officer in, what we actually briefed him on. Okay, here's the topics. You guys can read those. And we could talk a little bit about each one of these as we go through. I have a gigantic advantage here in Altoona in that my current director was my last facility sustainability officer. He was my AD, or my associate director. So that I gave him the same spill basically when he was the AD. So now that he's the director, he's able to implement or know how the whole system works. The GEMS program in the VA is kind of unique in that it's a one-man staff. It's me, basically. So the way we're organized, or the way GEMS works into our system, it's integrated into every section or team throughout the hospital. So everything from our nurses on up to our providers, everything is more of me being a Sherpa to show them or mentor them on what they can do and how they can do it to be more sustainable, and it's up to them to do it. We'll talk about some things that we integrated or programmed into our system here to help them do that. But these are from our director's commitment statement, which he reviews this every year and then republishes it. This is a regulatory authority for the GEMS program. Tells them what their goals and objectives are, or what they're supposed to be doing, or what they're responsible to do. There's responsibilities for our director. Like TJ said, greenhouse emissions is a major. Scope 1 and 2 emissions are relatively easy to do. Scope 3 emissions are rather difficult to get the right computation, and there's numerous ways of doing it. So that's a major challenge. Here's basically what I do. Which it looks pretty relatively simple, but when you break it down, it's pretty complex, and there's a lot of stuff going on every day. One of the major aspects of my job is getting out of my office and walking the facility and walking the hospital, because I can interact with the staff much more effectively, and I can also look for problem areas and try to solve it before it becomes a problem. We try to enforce to the staff basically to do no harm to the environment, but also to try to leave it better than you found it. That's like an old Boy Scout thing. If you have any family in the Boy Scouts, leave it better than you found it. And if you can get that in your behavior patterns of your staff, things like your styrofoam cups or your disposables or your waste management practices, or what waste stream goes into what, or their training and retraining for like RCRA, the Resource Conservation Recovery Act, teaching your staff, your nurses, your providers, where does the waste go and why does it go there, and how to protect your patients and your environment. A lot of environmental program is basically improving the environment for your patients. So it always works hand in hand. The way I look at it for implementing our GEMS program here is I try to do a synergistic approach. I try to look at what are the aspects and impacts of everybody who does a job at the VA. How does that work into what's the adverse effects of them doing their job as far as for the environment, and then can we do things to mitigate that or to fix it or to solve it? So it's a constant problem solving process, which makes your job really fun if you're doing it every day. Here's our standing environmental goals. In the federal government, we get an executive order normally from the president. He signs an executive order, which gives you goals and objectives of what he wants to accomplish as the federal government. And then the VA, or the Veterans Health Administration, breaks it down, and the VA breaks it down into how do we implement the grand scheme of things? How does that work in real life? And then the GEMS program at the facility level tries to support those objectives. And this is broken down into, on the left, you see the goals submitted to the Altoona VA Medical Center Director for the year. And then the one in the middle is submitted to Practice Green Health as far as recording what we are reporting to them. And then our EOC, which our Environmental Care Management Plan on the right, feeds into this also. So all the things across the hospital are actually feeding into those goals to meet those objectives in that executive order. Our goals are oriented toward achieving goals in a year. So many of these executive orders are like 5 years or 10 years down the road. So they sometimes change, and sometimes change is good because it provides a different focus for the facility to actually obtain goals and objectives to get to the end of the marathon, where you're actually reporting to the executive office that your executive order has been accomplished. And we've been very successful with this. We use Practice Green Health, which has been around for quite some time. It was, I think before Practice Green Health, it was Healthcare Without Harm. And it evaluates you on all those things that's in the green there. You compete against 1,500 hospitals and healthcare systems. So some of these hospitals have like 5 or 6 different branches. So it's a rather complex, and they grade you on what your data you've submitted in a year's time period. And our facility has been very successful. We were the first VA to win this award, which was a top 25 in the country. And they also, when they evaluate you as top 25, they also evaluate the top 10 in the nation for those different items like leadership and recycling, waste, chemicals, greening your OR, food, sustainable procurement, energy, water, climate, transportation, and green buildings. Altoona has been successful over the years as we've continued to win top 25 every year except for 2022, the COVID year. And in top 10, we've won every one of these things we've won except for food. We have not broken the code on food yet. So that is our challenge, to try to break the code on food. And we're analyzing the data and looking at it, and some things are stacked. The deck is stacked against a federal agency as far as how do you provide your food and what do you provide. The VA has a lot of elderly patients, and our patients desire meat and potatoes, beef. Our average patient age is probably well over 50. So they're a total different generation as far as what they like to eat. And we would rather have them eat what they like than provide the put the food in the waste, only provide to them what they're going to eat. And that's one of the things I was going to mention about TJ's response to composting and stuff. The VA has done a different approach. We've gone with automation, menu select items and stuff like that to not produce the waste to start with, only generate, only build, or only make what is required for the meal to provide it to the patient, and then having or implementing systems of preferred secondary meals or preferred secondary items using that product that you've cooked or made in other things like soups or other entrees or even sandwiches and stuff like that, if a patient desires to have the same type of meal and don't generate the waste to start with. That reduces, I'm on 22 acres here in Altoona, Pennsylvania, so I don't have a whole lot of area to do composting or anything like that. So we try to approach it differently. This is our 2024 priorities. And that pretty well concludes my presentation. I have additionally one other thing I can share with you. We do an annual report for our director in our GEMS program. Give me a second here. And I'll briefly go through this relatively quickly because I know we need time for question and answer. But this is our annual report. Can you see it?
I cannot yet. I have to try to share again. There,
Let me know when
it's
it pops
coming up
up.
now. Yep, it's there. I can see it.
Probably just a lag. Okay, the GEMS program does an annual report basically as a report card to our director to find out how we did. So we report, we don't only have the requirements of what our goals and objectives are, but then we do a report card every year to say where do we stand or where are we at. And it's pretty comprehensive. It goes through everything. That in the middle there is that is a top 25 award on the director's desk, and we basically have, we've won it since 2011, so we have one of these in every one of our quads desks. So we try to, like I said, due to synergistic effect, we put it in an area so when we do video teleconferencing and stuff like that, other people see that award and it generates more activity towards sustainable operations. People start thinking about how did you get that award? They'll ask questions like, how did you get that award? What did you guys do? So I'll be getting those questions like over the phone or over the internet or on a Teams meeting, basically saying, okay, how did you pull it off? How did you do it? And then I would present them the same thing I'm presenting to you, basically. This is how we do it. Okay, it gives you an executive summary. This talks about the regulations, directives, and policies change throughout the year, so we update this on a regular and recurring basis. I don't know how many of you are aware of how the federal government does construction projects, but it's a ongoing, it's a long-term effect. When we did our GEMS program in the VA, we based it on the ISO 14001 standards. And uniquely in central Pennsylvania, we also looked at our impact on the Chesapeake Bay. We're at the headwaters of the Chesapeake Bay. We probably have we're unique in Altoona having a very nice reservoir system that is protected from algae and sunlight because we have conifers in our feeding streams and stuff like that. So we have pretty quality water going into our reservoirs, and we try to get that through our through our utilization of our water effectively and through our sewer system to actually sewer what the best we can possibly do for the environment we're in. It's our performance. We won a federal energy management program for a small project. We had a small solar panel array put on our one of our new buildings. Many of our construction projects, our facilities kind of like Frankenstein. It was built in 1950. So as construction projects go, you never get a full implementation of a sustainable or a green project on your facility. You kind of like try to get it in each new project you do. So you try to integrate dampers for your HVAC systems, or more ambient light coming in your facility, shades that automatically open and close to reduce your thermal imprint inside your building, things like that. I spoke to TJ a little bit briefly yesterday about at our mental health area is utilizing battery powered lawn equipment, so you don't have the emissions, you don't have the noise, you don't have the risk, you don't have the vapors from fuel, any of those things around those facilities. So it provides a better environment for your patient's experience in those areas. A GEMS committee, we have a GEMS committee that is basically every aspect of our hospital is on our GEMS work group. So as you can see through there, there's a lot of different people on it. We do our compliance and conformance. We do inspections. We do internal audits, spill prevention, above ground and below storage tanks, stormwater prevention pollution, air emission opacity checks, environmental care rounds, spill prevention. You can go through this. Earth Day is a big thing. Like I said here, significant aspects and impacts. So every department highlighted their activities and then what aspect would they hurt in the environment and what are the impacts, and then how do we counter those. And then I go through what was our goals and objectives. Then I basically score it with stop signs. So like green means we achieve that goal, regulatory compliance. Yellow is ongoing, so waste disposal is probably always going to be ongoing because you never stop doing that. You continue to do it. Reducing energy uses, there's always technology or always something that comes out that you can improve that performance. And increase solid waste and recycling. These are our solid waste and recycling numbers. And our diversion rate is right around 50%, which is a very good goal considering all waste streams. And then we go through what is next, how do we improve stuff, and then management review every year, and the director signs it. Subject to your questions, that concludes my presentation.
Excellent. Thanks, Glenn. Yeah, great presentation, and just looking forward to the Q&A, which we'll have an informal question and answer session here. We'll